Hello, my name is Sarah Glenn Burkhalter, and with me is Hannah Cade, and we are graduate students from the Mississippi University for Women, and we'd really like to provide an overview of the Communication and Symbolic Behavior Scales developmental profile for you today. We're just going to talk about how it's structured, the materials it contains, its appropriateness, and all the things it takes to administer and score this evaluation and this assessment tool. Okay, so a quick overview of the CSBS. The purpose of this assessment is to identify children who are at risk for developing a communication impairment. It consists of 22 communicative and symbolic rating scales that are grouped into 7 different clusters, and those 7 clusters are communicative functions, gestural communicative means, vocal communicative means, verbal communicative means, reciprocity, social affective signaling, and symbolic behavior. The age range for this test is between 6 and 24 months, and also for children up to 72 months who exhibit atypical development. This assessment can be administered by caregivers and professionals trained to assess young children, such as speech-language pathologists, interventionists, and also psychologists, but only professionals are allowed to score the actual test. So other people can administer it, but professionals have to score it.
The CSBS-DP includes 3 components: an infant-toddler checklist, a caregiver questionnaire, and a behavioral sample. Administration time of the entire assessment can be anywhere between 45 minutes to 1 hour depending on the child. The child's parent or guardian should be present during the entire assessment and should react naturally to the child's communicative behavior. The caregiver should also avoid directing the child's behavior. The evaluator should speak in response to the child's communicative behavior, so the clinician should talk after the child has focused attention on an object or event or has initiated a communicative act. The evaluator should respond to the child by interpreting, acknowledging, imitating, expanding, or extending. The examiner should try not to ask questions except to request clarification or further information.
This test should be administered in a room set up for that only purpose. So the only purpose for this room is testing. There should be no other activities to distract the child, and if possible, it should be a small room with few interesting things for the child to look at that might elicit gestures from the child. You don't want anything to distract them during testing. All objects, except for the ones that are going to be used for the assessment, should be kept out of the child's reach. During the warm-up portion of the assessment, the child can be seated on a caregiver's lap, on the floor, or at a table. But for the remainder of the assessment, it's recommended that the child should be seated in a sassy seat, which is pictured above, and using that seat or a similar seat that attaches to a sturdy table. A high chair, booster seat, or a chair in a corner with a table positioned in front of it are also acceptable if the sassy seat is not possible or attainable, or a material that you have in your clinic. The assessment should also be recorded with a camera on a tripod or whatever kind of camera you have available, level with the child's eyes so that you can go back and watch it after the assessment is over.
The infant-toddler checklist is the first step in screening to determine if an evaluation is needed. The checklist enables people to take an early look at 7 key predictors of later language delays that are emotion and eye gaze, communication, gestures, sounds, words, understanding, and object use. The Caregiver questionnaire is a norm reference screening and evaluation tool that measures the communicative competence of children.
The behavioral sample. If an evaluation is needed, the behavioral sample would be performed first, and it includes 6 sections: the warm-up, communicative temptations, sharing books, symbolic play probes, language comprehension probes, and constructive play probes. We are going to discuss each section in more detail.
Okay. The warm-up section is first and should last approximately 10 to 15 minutes or as long as it takes for the child to respond to the solicitations for interactions. The evaluator will begin the warm-up section by saying the following to the caregiver. I am going to begin by asking you some questions about how your child communicates. You can hold your child on your lap or let him play on the floor. Normally, the evaluator will say the child's name in the instructions, but we are just going to say your child for the purpose of this video. The purpose of the warm-up is to allow the child and caregiver to become comfortable. The warm-up is very important to the assessment, and an inadequate warm-up can be detrimental to the quality of the communication sample. A few toys that are not included in the assessment should be included during the warm-up section. The CSBS kit includes a family house set for warm-up because it interests many children and allows the children to demonstrate turn-taking. The evaluator can use this time to ask questions about the child's medical and social history or clarify responses from the questionnaire. While talking with the caregiver, the evaluator should sporadically offer the child toys to engage the child in interaction. The examiner will end this section when the child appears comfortable interacting with the evaluator or after 15 minutes.
So after the warm-up, the examiner moves on to the communicative temptations section. This section should last approximately 10 to 20 minutes. The evaluator will say the following to the caregiver to begin this section. We want a sample of how your child communicates with sounds, gestures, or words. First, I'm going to present some situations that will encourage your child to communicate. Wait for your child to communicate to you. Please try not to direct your child or tell him what to do. Also, try not to ask him too many questions. When your child does communicate, try to respond naturally by helping him or her notice what he's playing with. The evaluator will put a series of communicative temptations that are structured situations and are designed to elicit child-initiated communicative acts. If the child does not readily initiate communicative acts, prompts can be used, such as saying the examiner could say something like, "Need help?" There are 8 parts in this section. For each part, the evaluator will demonstrate an action on a specific item and then give the child the item and wait for the child to signal for help or respond. The items used in this section include a wind-up toy, balloons, bubbles, the game of peekaboo, the game of walk-a-mouse, creep-mouse, blocks in a box, a jar, and toys in a bag. Prompting strategies are used for each part in this section to encourage the child to communicate if the child is hesitant. So the whole point of this part of the evaluation is to present the child with something that's going to tempt them to communicate, and then charting what they do in those communicative attempts.
The sharing books section is next and lasts approximately 5 minutes. The evaluator will say the following to the caregiver to begin this section. Now we want to see what your child does when looking at books. Try to avoid telling your child what to look at or asking your child to label the picture. Follow your child's lead by noticing or labeling the picture that he directs your attention to. The evaluator will show the child 3 of 4 books from the CSBS kit and encourage him or her to select one. After the child has selected one, all other books the child doesn't select should be removed. The evaluator will allow the child to examine the book while displaying interest in it. After the child finishes looking at the book, the exercise should be repeated with both the child's second and third choice.
The next section is symbolic play probes, and it lasts approximately 10 minutes. The evaluator will give the caregiver the following instructions to begin this section. Now we want to see how your child plays with different sets of toys. Again, try to avoid telling your child what to do or asking your child questions. Follow your child's lead by commenting about what your child is doing. This section of the test includes 2 different toy sets. Set A is a feeding set and Set B is a grooming set. The toys in each set should be organized into 2 different levels. Set A level 1 includes 2 cups, 2 bowls, and 2 bottles, and then Set A level 2 includes 1 frying pan, 1 spatula, 1 mixing bowl, and 1 serving spoon. So you can see how those materials get a little bit more in-depth in Set A level 2. Set B level 1 includes 2 combs, 2 brushes, and 2 toothbrushes. Set B level 2 includes 1 doll diaper, 1 powder dispenser, 1 washcloth, and 1 receiving blanket. Materials in Level 1 are presented to all children, and the materials in Level 2 are presented only if the child demonstrates action schemes toward others. In addition to those toys, a doll and Sesame Street characters are used. First, the evaluator will allow the child to choose either the doll or the Sesame Street character, and then will offer the child a choice of toy sets, set A Level 1 or set B Level 1. After the child has chosen a set, the evaluator will allow him or her to initiate play for a few minutes with the toy set chosen. There are prompts to be used if the child does not demonstrate action schemes towards the agent. If the child does demonstrate the action schemes, then the evaluator will add toy set A Level 2 or set B Level 2, depending on what they chose, and allow the child to play for a few more minutes. After the child plays with that set for approximately 5 minutes, the evaluator will probe for the use of sophisticated symbolic play by first giving verbal instructions such as, "The baby is hungry," or "Show me how you feed Big Bird." Next, the evaluator will remove the first toy set and offer the child the second toy set. For example, if the child began with set A, the evaluator will offer set B, and vice versa. If the child demonstrates single action schemes towards others, the evaluator will add level 2 and allow the child to play for a few more minutes. The symbolic play probe should not be repeated after the second set.
Next is the language comprehension probe section, and it lasts approximately 5 minutes. The evaluator will begin this section by giving the caregiver the following instructions. Now we want to see how your child understands words by asking him to point to body parts. What body parts does your child know? To probe linguistic communication, the evaluator will ask the child to identify different body parts selected from the following choices: head, hair, eyes, nose, mouth, ears, tummy, hands, and feet. The evaluator will say, "Where is your blank?" with stress on the items being tested. Other phrases that could be used include point to blank or show me blank. It is crucial that no gestures or cues are given by the evaluator that may guide the child's responses in order to assure that linguistic comprehension is being measured. If the child does not identify a body part, the evaluator will demonstrate one body part by showing the child where it is and then having the child find it. This demonstration item cannot be counted as a correct item. The evaluator can say the name of each body part up to 3 times to get the child to identify it, but no repetitions are allowed if the child is identifying the wrong body part. The evaluator can present up to 6 body parts and stop after the child has correctly identified 3. This section should be repeated using agents such as the child, the caregiver, the doll, or the Sesame Street character. If the child correctly selects 3 different body parts and 3 different agents, then the evaluator will ask the child to identify possessor-possession combinations using the body parts and agents that the child had previously identified. For example, the evaluator will ask the child, "Where is the baby's hand?" or "Where is mom's nose?" The evaluator may present up to 6 different possessor-possession combinations and stop when the child has correctly identified 3.
Last, we have the constructive play probe section, and it lasts approximately 5 minutes. The evaluator will give the following instructions to the caregiver to begin this section. Now we want to see how your child combines objects in play. Again, try to avoid telling your child what to do or asking your child questions. Follow your child's lead by commenting about what your child is doing. The materials needed to probe constructive play include set 1, which is 5 blocks, set 2, 5 stacking rings on a stacker, and set 3, 6 nesting cups. The evaluator will begin with set 1 to assess constructive or combinatorial play and will engage the child in a turn-taking game of building a tower and knocking it down. Then the evaluator will give the child the opportunity to build a tower without assistance. Next, set 2 will be presented. The evaluator will take the rings off, mix up the order, and encourage the child to put them on. If the child correctly stacks at least 4 blocks of rings, the evaluator will present 3 nesting cups and engage the child in a turn-taking game of either nesting or stacking the cups. The evaluator will give the child the opportunity to combine the cups without assistance, and if the child successfully combines the 3 cups, then all 6 will be presented.
Immediately following the behavioral sample, the caregiver should be asked to complete the Caregiver Perception Rating Form. The caregiver will rate the child's behavior during the sample in terms of how typical it was. The evaluator can also interview the caregiver by using this form as a guide. If the caregiver notes that his or her child's behavior was less than typical in the areas of communication and play behavior, obtaining another sample or observing the child in a different context may be necessary. The evaluator will report the discrepancies when interpreting the results of the assessment.
Okay, so the CSBS encourages the examiner to watch back the sample so that they can score, use the score form properly. Starting at 0 on the video for the time, you play the video, and at the first communicative attempt, you stop the video and then record the time on the form. You mark first what kind of communicative function the child had when they used that communicative act. Then you mark whether or not it was respondent or if it was reciprocal. Next, you decide if the act contains a gesture and determine what kind. If it contains a vocalization, determine if it's a vocal act with or without a gesture, if it was a syllable, or if it was multisyllabic. Then, if they used a consonant in that communicative act, you can circle the consonant on the record form or the consonants that they used. You want to note any words said, single or multi-word utterances. You want to note that. And then next, you note the child's use of repair strategies. And to count as a repair strategy, the child must either repeat the same communicative act or modify the act when the goal is not achieved. Next, you determine the rate of communicative acts per minute, and we can do that by dividing the number of acts by the time after you break it into 60 seconds, 60-second intervals. Next, we have to rewind the tape to count the rate of social affective signaling parameters. These are things like gaze shifts, positive effect with eye gaze, and episodes of negative effects. So we want to count each of those over the course of the sample. At this point, the examiner counts the frequency of occurrences of each parameter and totals them. Then the clinician moves to the worksheet for rating symbolic behavior, counting the number of times they demonstrated a particular action, either towards an object, towards another person, or multiple actions. So that's what we're counting when we did those communicative temptations, and also how they used those toys that we presented them with. Did they do something with them? Were they able to point at a body part? They do not get credit for imitation. Next, the clinician counts the child's language comprehension by examining the child's behavior as toys are put away, and also the comprehension of body parts and agents and possessors that we talked about earlier. Lastly, the examiner rates the child's constructive play, counting the highest number of objects that were combined. So how many blocks did they stack? Did they stack all of the cups that were provided, or did they put all of the rings back on? So count the highest number that they were able to put together. Destructive acts do not count towards their total. Okay, and then for scoring, the scoring procedure yields, after all of the raw scores from the different 22 communicative parameters, they're converted into scaled scores. And those raw scores and scale scores for the 22 scales pictured here along the top of this little chart. And then percentile ranks are standard scores for the 7 clusters, which are pictured. Okay, and so those 22 are clustered into the 7 different clusters that I mentioned earlier. A percentile rank are standard overall composite score, and then norms by chronological age or language stage.
Okay, for our impressions, the pros for this test or this assessment include the CSBS is norm referenced and supported by both field validation and psychometric studies. Also, the procedures were very thorough and easy to understand and learn, and they are set up in a way that easily engages children by the use of various toys and activities. And this assessment also has specific precautions that will lead to the true measurement of a child's language and communicative ability. As for the cons, the scoring process for this test was a bit complex. Figuring out how each parameter was counted, then placing those numbers in the correct grids got confusing and a little overwhelming. And this could be because we use the outdated model the clinic had available here, the 1993 version. We do think that the newest version of this test could potentially be easier to score, but we can't say that for certain without looking at it. But overall, we believe this test would be an appropriate choice for assessing communication and behavior in 6 to 24-month-olds and older children if they are delayed.